Brought to you by Dr. Joe Ordia. Frequently asked questions about neurosurgery and pain management. Questions 106 to 110. Laughter and the brain. I start with a disclaimer. The opinions expressed here are for general information and based on my own professional experience. They are not intended to replace the advice of your healthcare provider on your particular condition.
Question number 106. I often hear you say that laughter is the best medicine. Can you explain what you mean?
Answer. There is an abundance of scientific evidence that laughter stimulates the release of 4 neurochemical messengers: dopamine, oxytocin, serotonin, and endorphins, endogenous morphine. They are commonly referred to as, quote, feel-good hormones, unquote, because they contribute to positive emotional states and happiness. Dopamine supports the brain's reward pathways. Oxytocin promotes bonding and social connection and is sometimes referred to as, quote, love hormone, unquote. Serotonin regulates mood and sleep, while endorphins act as natural pain relievers. Additionally, laughter suppresses cortisol, the primary stress hormone, and by lowering heart rate and blood pressure while relaxing muscles, it can reduce stress, enhance immune function, and support both psychological and physical well-being.
Question number 107. It is interesting that laughter can make me happy and reduce my pain. Are there other things that I can do to increase my feel-good hormones levels that does not involve taking medication?
Answer. Laughter is the best medicine. Other activities that have been shown to boost the release of feel-good hormones in the brain while reducing pain and stress include social connection, shared celebrations, physical exercise, yoga, meditation, prayer, listening to or playing music, and singing. Complementary therapies such as acupuncture and massage may offer similar benefits.
Question number 108. I now understand why my favorite song brings me such comfort. I always carry a laminated card with the lyrics. You are a man of peace. Would you be willing to sing the prayer of Saint Francis?
Answer. That is quite an ambitious request. Don't expect the dazzling voice of Andrea Bocelli, but I'll try. The joy of laughter is multiplied when it is shared, so I invite you to join me and play the piano as we perform the opening verse. Make me a channel of your peace. Where there is hatred, let me breathe your love. Where there is injury, your pardon, Lord. And where there's doubt, true faith in you. Make me a channel of your peace. Where there is despair in life, let me bring you home. Where there is darkness, only light. And where there's sadness, ever joy.
How peaceful and joyful. Thank you so much, Doctor.
Thank you.
Question number 109. Why do some hospitals have chapels and provide spiritual care?
Answer. Hospitals and healthcare systems recognize that challenging medical conditions can provoke intense reactions in the brain that can result in emotional and spiritual distress, which can hinder healing and recovery. In severe, chronic, or painful illness, Activation of the stress response results in increased levels of cortisol and catecholamines. Associated inhibition of the neurotransmitters, serotonin, dopamine, and norepinephrine can contribute to central sensitization and heightened pain perception. Successful treatment of challenging medical conditions requires a holistic approach in which both the physical illness and the spiritual distress are addressed. Hospital chaplains are trained to offer inclusive, non-denominational care that meets the spiritual and emotional needs of people of any religious belief, including those with no religious affiliation or who identify as atheists. The role of chaplains extends beyond patient care to include families who are facing grief and uncertainty, and hospital staff who are coping with physical and psychological stress and burnout. Chaplains are available to meet in the emergency department, at the bedside, in the chapel, or in any appropriate hospital location to listen and offer counsel. Individuals may also visit the chapel independently as a calm and welcoming space for prayer, meditation, or quiet reflection.
Question number 110. How does the happiness that you get through laughter differ from the happiness produced by prescription medications?
Answer. While both processes occur within the brain, the biological pathways are different. As previously discussed, laughter triggers the release of the 4 feel-good hormones. Dopamine supports pleasure and reward, oxytocin promotes social bonding, serotonin stabilizes mood, and endorphins are natural analgesics. Shared laughter creates a ripple effect of joy, underscoring the value of mingling, giving, and sharing. Help others to the best of your ability, even if a few think that your generosity is their entitlement. Laughter also reduces physiological stress and enhances happiness by suppressing the production of cortisol, the stress hormone. The medications which are commonly perceived as promoting happiness are typically antidepressants, especially selective serotonin reuptake inhibitors, SSRIs. While they may bring happiness, the primary purpose for the prescription is to treat a medical disorder by addressing neurochemical imbalances in the brain. SSRIs work by blocking the reuptake of the neurotransmitter, serotonin. The increased serotonin in the brain stabilizes mood and emotion and help in the treatment of anxiety, depression, post-traumatic stress disorder, PTSD, and obsessive-compulsive disorder, OCD. Laughter provides a complete dose, dopamine, oxytocin, serotonin, endorphine of happiness without taking a pill. It is freely available, does not require a prescription, and carries no financial cost. The benefit is almost immediate, and it poses no risk of significant side effects or adverse interaction with other medications. A smile on your face brings joy to you and to those around you. If you feel offended by others, respond with a smile, your silent strength that can neutralize any ill feeling. By contrast, prescription medication requires consultation with a medical professional, a prescription, and financial expense. The medication is often regulated and requires careful consideration of side effects, interaction with other medications, and potential for drug dependence. It typically takes 2 to 4 weeks before SSRIs begin to take effect, and they are often more effective when combined with psychotherapy or cognitive behavioral therapy, CBT.